It starts as a quiet morning stiffness. Then it's a sharp pinch on the stairs. By 50, your knees start telling a story you might not want to hear. Hi, I'm here to help you decode those signals. If you're over 50, knee pain can feel like an unwanted new roommate, but it's not just old age. There is a biological shift happening inside your joints right now. Understanding this shift is the first step to reclaiming your mobility and living without limits. Today, we're going deep. We'll look at the anatomy, the common culprits, and most importantly, the actionable steps you can take today to protect your future self. Think of your knee as a masterfully engineered hinge. It supports nearly your entire body weight with every single step you take throughout your life. That hinge is protected by cartilage, a smooth, slippery tissue that's actually tougher than it looks. It's your body's ultimate shock absorber, designed for decades of use. But it's not just the tissue, it's the fluid. Synovial fluid acts like the oil in your car's engine, keeping everything gliding without friction and nourishing the cells. By the time we hit 50, that oil often starts to thin out and the cartilage begins to lose its youthful elasticity. This is where the subtle trouble often begins. The most common culprit is osteoarthritis. It's the gradual breakdown of that protective cartilage until bone starts to meet bone, causing significant discomfort. You might feel a grinding sensation, or notice that your knees feel like they need a warm-up period every morning just to get moving comfortably. Then there's the meniscus. These little shock absorbers become more brittle as we age, making them prone to small tears even during normal daily activities like turning. If you've ever felt like your knee was locking or catching mid-stride, your meniscus might be trying to send you a warning signal that needs attention. We also can't ignore bursitis. These small, fluid-filled sacs cushion the outside of the joint. When they get inflamed, even the light weight of a blanket can hurt. Inflammation is often a response to repetitive stress. Maybe you spent all weekend gardening or finally started that walking program just a little too quickly. And don't forget tendonitis. The tendons that connect your muscles to your bones can become irritated, causing a dull, persistent ache right below the kneecap. Have you ever felt like you could predict the rain with your knees? You're not imagining things. Barometric pressure changes can actually cause joints to swell. When the pressure drops, the tissues around your joints can expand, leading to that heavy, achy feeling that often precedes a storm or a cold front. One of the most frequent questions I get is, should I use heat or cold? The answer depends on what kind of pain you're experiencing at the moment. Use cold for acute injuries or after a long day when your knees are swollen and hot. It constricts blood vessels and numbs the sharp pain quickly. Heat is better for chronic stiffness, especially in the morning. It relaxes the muscles and increases blood flow to help your joints feel more flexible. While some aging is normal, there are specific signs that mean it's time to stop self-treating and see a healthcare specialist immediately for an evaluation. Number 1. Rapid severe swelling. If one knee looks like a balloon compared to the other, that's not just wear and tear, that's a signal of acute inflammation. Number 2. Heat and fever. If the joint feels hot to the touch, or if you have a low-grade fever, it could indicate an infection that needs urgent medical attention. And number 3, instability. If your knee feels like it's going to give out when you put weight on it, your joint structural integrity might be at risk. The good news? You have far more control over your knee health than you might think. Let's talk about the big 3 of joint protection strategies. First, weight management. Did you know that for every pound you lose, you take 4 pounds of pressure off your knees with every single step you take? That means losing just 5 pounds is equivalent to removing 20 pounds of mechanical stress from your joints. It's the most effective non-surgical treatment available. Second, we need to build a natural brace. Your muscles, specifically your quadriceps and hamstrings, are the primary stabilizers for your knees. When these muscles are strong, they absorb the impact of walking, standing, and climbing stairs, so your bones and cartilage don't have to bear the brunt. Focus on low-impact activities. Swimming, cycling, and water aerobics are fantastic because they build strength without the pounding of gravity on the joints. Don't forget flexibility. Tight calf muscles and hamstrings can pull on your knee joint, changing how you walk and increasing the pain you feel. Regular, gentle stretching helps maintain a full range of motion and keeps the joint lubricated through movement, preventing the dreaded morning stiffness. Try starting your day with simple ankle circles and seated leg lifts before you even get out of bed. It wakes up the synovial fluid and prepares the joint. Third, look at your feet. Your shoes are the foundation of your entire skeletal alignment. Worn out or unsupportive shoes can wreak havoc on your knees over time. If the soles of your shoes are worn unevenly, it forces your knees to rotate inward or outward, accelerating cartilage damage in ways you might not feel yet. What you eat matters too. Anti-inflammatory foods rich in omega-3 fatty acids can help manage the systemic inflammation that often worsens joint pain. And stay hydrated. Your cartilage is approximately 80% water. If you're dehydrated, your joints will be the first to feel that lack of cushioning. Many people ask about supplements like glucosamine or turmeric. While the research is mixed, some people find significant relief. Always consult your doctor before starting any. Living with chronic pain is draining. It's important to acknowledge the mental toll and stay connected with activities you love, even in modified ways to stay happy. Isolation can actually make pain feel worse. Staying social and active keeps your mind focused on what you can do, rather than what you can't do anymore. So, here's your roadmap. Manage your weight, strengthen your support muscles, wear the right shoes, and eat for inflammation to protect your joints. And most importantly, don't wait for the pain to become unbearable. Early intervention is the absolute key to avoiding invasive surgery later on in your life. Your knees have carried you through 50 incredible years. With a little extra care and attention, they can carry you through many more. You've got this. If this helped you understand your body a little better, please subscribe to Adult Health Hub. We're here to help you stay strong, healthy, and informed. See you next time.